Hello and welcome to the Arise interview. 60 minutes of big questions about the big stories from the news and beyond with fresh insight and critical analysis. I'm Charles Anyagolu. Coming up in the next hour, with lawmakers in the House of Representatives, officials in the Health Ministry and medical experts in the Centers for Disease Control, as well as the Nigerian Central Bank, rising to the challenge of the coronavirus. What about the man who sits behind the resolute desk at Aso Rock, who has cloaked himself in the mantle of the take charge, change president? We'll speak to a supporter and an opponent of Mr Buhari as Nigerians debate why the president has up till now failed to address Nigerians on the coronavirus outbreak. Plus, the questions about the coronavirus that scientists, virologists and epidemiologists all over the world are still struggling to answer. There's a great deal that's still unknown, including how dangerous the disease might prove to be and how far the pandemic could spread. We'll speak to one of the leading virologists in Nigeria. And later, what's the Nigerian government's strategy with regard to the dissemination of information about the coronavirus pandemic to the remote parts of Nigeria, where there are no televisions, no internet, virtually no radio sets, no electricity, and no running water? We'll speak to a representative from Nigeria's National Orientation Agency, the government department charged with increasing awareness about such issues. In a moment. Now, nations, like individuals, reveal themselves at times of crisis, as one journalist in the UK put it. In emergencies of this immense magnitude, it soon becomes evident whether a sitting president is equal to the moment. So, how has President Buhari lived up to the challenge of stepping up to the plate and taking charge of the coronavirus outbreak in Nigeria? Well, as Segun Adeniyi pointed out in his This Day newspaper column last week, President Buhari is yet to personally take ownership of a crisis that has already sent the 2020 budget spinning like a yo-yo, and that's a direct quote. Mr Adeniyi suggests that Mr Buhari has continued to act as if Nigeria is insulated from a pandemic that's practically turned the world upside down, whereas presidents all over the world, including those in Africa, are rallying their people and placing their authority behind measures to deal with the global emergency in their respective countries. Well, for more on how President Buhari is handling the COVID-19 crisis, I'm joined now in the studio by Prince Kasim Afebuwa, the 2019 presidential election spokesman for the opposition People's Democratic Party, and from our off-site studio in Abuja by a senior member of the ruling All Progressives Congress and former Commissioner for Information in Adamawa State, Ahmed Sajo. Thank you very much indeed for joining us. And I'll start with you, Kasim.
It's a pleasure. Thank you very much.
Let me start with you, Kasim. What's your assessment of how President Buhari has handled the coronavirus outbreak in Nigeria?
I think the opinion by Segun Adeniyi has captured the whole essence of the president's response and how he has treated us with some kind of disdain, you know, because just like you said, quoting a British journalist, you know, it is only when nations are in crisis that you know the kind of leadership that you have in place. And we are expecting that our president should, for once, you know, seize the wave of the moment to rally Nigerians around this pandemic with a view to finding, you know, permanent solution to it. Because if it continues in this, you know, layback, you know, attitude, with the 2020 budget and with the economic downturn, I think we're in for serious trouble. So for me, I think those who are the advisors of Mr. President, his handlers, ought to kick him at the butt to move and show leadership for once in a country that is already in the circle of, you know, nations afflicted with this pandemic.
But I mean, let's face it, Prince Kasim, you've got a presidential task force in place. You've got state governors, local health officials, the Ministry of Health, the Centers for Disease Control. all of them addressing the issue of the coronavirus and taking appropriate action. Is there a particular need for the president to throw his leverage into the fray, given all of that?
You see, as I was coming here, I was confirming a story that the UK Prime Minister, Boris Johnson, has tested positive. And he was speaking right from his bedroom, where he's being quarantined or in isolation, and being attended to. That's leadership. He's not found wanting in terms of where he is at any point in time.
And he's not hiding the fact that he's got a disease.
He's tested positive. Yeah. We got news that the president tested negative. We got news yesterday that he was in the office, even when we heard that that particular office was fumigated. That means the president also was in the office at the evening of that same day. Then the presidents of countries are coming out to speak to their citizenry so that that national consensus, you know, that will represent the aggregate interest of all of us, is captured in the leadership, not all these delegated responsibilities and persons who you have, you know, enunciated. The secretary to the government of the federation, to all intents and purposes, is a lawyer. He shouldn't be heading the presidential task force on a pandemic that has to do with pure sciences, you know. So I wouldn't know the rationale, but of course, this is a government that puts square peg in round holes. So I wasn't surprised. But talking seriously, I think this is a time for the president to rise up to the occasion. We want to see our president talk to us, speak to us, and telling us and reassuring us, because he's the president that Nigerians voted for. They didn't vote for all these persons he appointed, whether they like it or not. Let us know that he's even alive. Let us know that he's safe and hale and hearty. If he's been afflicted, it's not a death sentence, just like the spokesman to the president said. This being tested positive is not a death sentence. So, but when you listen to a presidential spokesman told Nigerians a day ago, I think yesterday, that it's a matter of style for the president to have delegated responsibilities and all of that, and now there's no need for us to panic. The president even went to the office and all of that. It lives in a leadership vacuum, because when the president speaks, it's different from when a secretary to the government of the federation speaks.
Yeah, I think quite a lot of people would agree with that. But let me bring in Ahmed Sajo, who is in our off-site studio and who is a senior member of the President's Party, the ruling All Progressives Congress. Thank you very much indeed for joining us. Mr. Buhari has so far not addressed Nigerians directly on the virus and has not taken visible charge of it, as most other leaders around the world have. Do you think that that is the right or the wrong approach?
Thank you very much. I think what a government needs are two things. The first is the political will to deliver on a mandate. And the second one is to ensure that institutions are functioning the way they should function. And I think if you put the situation on these two platforms, the political will had been demonstrated very enormously, and you're talking about the secretary to the government has to be a medical doctor. You cannot have a secretary to the government that is a professional in every field. So if this were a legal problem and the secretary to the government was not a lawyer, you would say you need a lawyer. If the secretary, if this were a cultural problem and the secretary to the government is not a cultural officer, it's not proper. I think the secretary to the government demonstrates the political will, the political leverage to apply government authority in a matter. And the second thing is that definitely are the institutions that are supposed to function, are they functioning? The Ministry of Health, is it functioning? Is the National Center for Disease Control functioning? We have seen countries where the president speaks every minute, but that the National Center for Disease Control had been decapitated, and that the country is found, you know, in a situation where it cannot manage the pandemic. Because it's not about the president talking. It's about the institutions of governance functioning well. It is about the capacity of the government to muster sufficient political will to move the process on traction so that it can intervene in the manner
I'm afraid, Ahmed Sajo, I beg to disagree with you, because it is about the president taking charge and speaking to his people. This is one time, at times of emergency, it's been described as a time of war. This is a time when the president needs to be seen. I mean, what's the point of voting him into office if he's not there at a time of emergency? Every single head of state around the world is taking charge directly. Why can't the president of Nigeria do that? I mean, you're defending something that is clearly indefensible.
No, the president is in charge. Who says the president is not in charge? The president is in charge. Who appointed the secretary to the government? Who appointed the minister?
Why is it that we can't see and hear directly from the president? Why is he not? I mean, if you look around the world, from President Trump to the South African president, to the president of Rwanda, to the president of India, to Ghana, they're all taking charge and giving daily briefings to the media about what is happening in their countries. Why not President Buhari?
Buhari is taking charge and giving daily briefings through the officers he has directed to do so.
Giving daily briefings. We haven't seen him on television addressing the people of Nigeria directly, holding press conferences along with the health minister and all the other people, the Centers for Disease Control. We haven't seen that.
But are the systems functioning or are they not functioning?
That's not the question. The question is, at a time like this, you need to have leadership from the very top. That's the issue.
At a time like this, you need a functional system of government. You need institutions of government that are functioning. You need institutions of government that are intervening very practically in the process. This is what you need.
Okay,
leadership governance is about institutions.
Right,
working institutions.
Let me ask you to stay with us, Ahmed. We're going to come back to you in a moment. You're watching the Arise interview. Plenty more still ahead as we continue our debate about how President Buhari is handling the COVID-19 crisis in Nigeria. Stay with us. Welcome back to the Arise interview. Champ Charles Onyekolo. Now, as the coronavirus sweeps through the world, Nigeria isn't left out, and many Nigerians are examining how their leaders at the state and national level have reacted to the threat, while many on the streets have given high marks to local and state leaders in Lagos, as well as the Federal Ministry of Health and the Centers for Disease Control in Abuja. Most have ranked the response of President Buhari as poor or very poor, arguing that in times of crisis, citizens should be able to look to their leader for reassurance. But supporters of Mr. Buhari say he's set up a presidential committee to deal with the virus and has issued several statements and written about the virus, and this should suffice for now. But critics insist that more than ever before, especially in the case of a devastating pandemic such as this, the #1 citizen should lead from the front. And with me in the studio, Prince Kasim Afebua, the 2019 presidential election spokesman for the opposition People's Democratic Party. And with me from our off-site studio in Abuja, a senior member of the ruling All Progressives Congress and former commissioner for information in Adamawa State, Ahmed Sajo. Stay with us, Ahmed. Let me put this to you first. Kasim Afebua, the Nigerian president, Muhammadu Buhari, has recalled, that's the news today, recalled disease control experts from overseas. He's urged people not to succumb to panic because of the virus. He's sent out a series of tweets saying the government was working to ensure that supplies of food and other essentials would be maintained. I mean, that sounds like someone who's leading.
Are you sure you were able to verify the authenticity of those tweets?
Well, it's coming from the president.
because we've been hearing all manners of fake news, whether they are true or not.
This is definitely coming from the president.
Okay, fine.
We know that for sure.
Fine. And that takes me to the letter that emanated from the presidency also, where they said 10 billion has been given to Lagos State as grant, and 5 billion.
So it's been approved for Lagos State.
Okay, approved,
yes.
And 5 billion to the NCDC, National Disease Control Center, and all of that. But that particular letter, even though it's carrying the seal of the president, was not signed. So we cannot also verify the authenticity of that particular statement. That's by the way. Let me quickly remind Ahmad Sajo that the president, in situations like this, represents the repository of the political will that is so much desired to lead from the front and not from the back. Because when you say someone is a commander-in-chief, he has to, assume and play that role to the admiration of the citizenry. When in times like this, when we have problems on our hands and we can't see the president, it gives room for all manners of speculations. And I'm sure, Charles, you must have heard that they said the president has traveled to UK, that he's been flown or smuggled out because he's tested positive to the COVID-19 and all of that. And so because there is no communication, because they are hiding the president in the inner fortress of the villa, we are not seeing him, so it gives room for all manners of speculation.
Yeah, but that's not entirely fair, to be honest, because, I mean, his spokesman, Femi Adesina, has been out and about in the media and has tried to dispel those rumors, as well as the Minister of Information.
You can say the spokesman is dispelling, but the time the president spent over 100 days in the UK, they told us that it was hale and hearty. Until the man came back, the president came back and told Nigeria that he has never been this ill. And so what are we talking here?
Right.
So we have a precedence, and that's why we are saying that at moments like this, with all the panic across the whole wide world, we need to see our president talking to us. We need for him to engage us, to interact with us, to reassure us that yes, this pandemic has come here. These are the measures we are putting in place. And he was talking about Boss Mustafa, the secretary to the government of the Federation. If you are setting up a task force, I expect the Minister for Health, who is a medical doctor, to be the head. You don't need a lawyer to sit down there who will be reading out, prepared speeches and all of that. People should speak to this pandemic. Professionals should speak to it, and they should guide us, along the line. There's not enough sensitization or mobilization of the public. There's none. Even the National Orientation Agency, I have not seen their involvement.
Well, we're going to talk to the National Orientation Agency later in this program, but let me bring Ahmad Sajo in. Thank you very much indeed for staying with us. You are, of course, from the ruling All Progressives Congress, which is President Buhari's party. What about the argument, Mr. Sajo, that's been made in the Senate, that if the president addresses Nigerians, both people and government agencies would be more serious in adhering to the preventive measures that are being prescribed? Because at the moment, people are not necessarily taking the social distancing and a lot of the other things that are being suggested, the stay at home, the self-isolation, and so on, as seriously as perhaps they ought to.
I think you have taken it as seriously as you ought to. That's why I'm not very close to my brother, Kashim Afegbua. We should have been very close to each other, but you have kept us at a social distance.
Well, let me put it this way. Arise News, let me put it this way. Arise News is taking it seriously. I don't know about the rest of the country.
We are all taking it seriously. That's why you took it seriously. But let me put it this way very clearly. When you started this segment of the program, you started by saying Nigerians are commending Lagos State government, the Federal Minister of Health, National Center for Disease Control. That is something very cheering. These agencies of government, including even the state governments, are all working, under the leadership of the president himself. So if the president had failed to provide leadership, we wouldn't be commending any segment of the government that he leads. So in truth, it's like I said, and I keep emphasizing, is that institutions of government must be alive to their responsibilities at times like this. No matter how many times the president speaks or faces the public, if there is a breakdown, there is an institutional breakdown, and that the system, is ravaging the country, it doesn't make any sense. So what matters is that we should be able to contain the spread of the deadly virus. We should be able to rise above political differences. We should be able to rise above all our differences to face a common enemy, an enemy that is unseen, an enemy that no matter how powerful your military force is, you cannot confront it, you cannot defeat it. You can only defeat it by institutions that are working perfectly.
Right.
And that what this government is trying to do, and what this government has done, is to create an enabling environment for the professionals in the Ministry of Health, from the minister down, to be able to intervene and perform their functions in an effective manner.
Right, okay. Let me just come in there. You've made that
the
point.
roadmap for everybody that is concerned.
Okay, I understand
with the fight
that,
against this
Mr. Sajo, and your contention is essentially that we're seeing the kind of leadership that we would need to see to stop this epidemic in its tracks. With me in the studio here is, of course, Prince Kasim Afebua, who is from the opposition People's Democratic Party. As this virus, this pandemic escalates every day in Nigeria, and we are seeing it escalating, what would you say that we've learned about the leadership of this country as it confronts this national and global catastrophe?
Well, first and foremost, let me commend the government of Lagos State, and particularly the governor, for the kind of leadership we have seen. It will have been a different scenario if the governor has sent his secretary to state government or his commissioner for health to be the poster boy, the arrowhead of this whole process. But you saw the governor, you see him every day, visit places, insist certain things have to be done, putting certain places, calling on corporate bodies, and they converted the stadium to isolation centers and what have you. That is leadership. When the Abule Ado crisis happened, you saw the governor visited there a couple of times, and he called on other good-spirited individuals to please join hands with him to provide succor for those who were affected. Until we saw the governor of Lagos visited the villa to show pictures of the carnage. For God's sake, the presidency didn't consider it important for the president to visit that kind of thing. You see, at moments of crisis, we need our leader, we need our president to show leadership, to lead the way. I don't want to celebrate a leader who sits in the inner fortress of the villa and is being briefed because he says, like Ambassador said, the institutions are functioning. No. I want on the spot, hands-on leadership that is able to speak to the issues and show a clear-cut direction at such critical times. And that is what we are seeing lacking in this sense.
Okay, you've made that point. Let me bring Ahmed Sajo in, because he does have a right to reply. And Ahmed Sajo, I mean, you have to admit that Prince Kasim Afebua has a point there. I mean, are we not supposed to defer to the president in times of national emergency? I mean, if this was a war, you know, we would expect the president to be out there leading the country. And as President Trump has said, this is a war.
I agree with you, this is a war. And I agree with you also that in this war, we need to come together, all of us, whatever our political persuasion, and we need to rally around the leadership. We need to rally around the institutions of governance, especially those that are responsible for responses, so that we can collectively as a people respond appropriately to this crisis. I agree with you that without the political will and the political leadership of a country or a system, the system cannot function. And I want to assure you that there is sufficient political will on the part of the government to ensure that we confront this battle the way we ought to confront it, and we are confronting it up to this level, and by the special grace of God, we are containing the escalation. We've seen other countries where the pandemic had escalated beyond the control of the leaderships and the systems within a short period of time. And mercifully, in our own case, the pandemic has not overwhelmed us beyond the control.
Fred, I'm going to have to jump in there, Ahmed Sajo. I want to thank you very much indeed. Ahmed Sajo is a senior member of the All Progressives Congress, President Buhari's party, and also Prince Kasima Febua from the opposition People's Democratic Party. Thank you ever so much. You're watching the Arise interview. Plenty more still ahead, including we'll hear from a leading virologist about what is known and isn't known about COVID-19. Stay with us.